Hello, it's 9 p.m. in RTD. It's time to English New Edition. For tonight's headlines, we have Prime Minister Abdul Qadir Kamil chairs crisis meetings on COVID-19 at the People's Palace. For the international scene, Italy has recorded 1,000 dead in 24 hours. Welcome to our newsroom. Prime Minister Abdul Qadir Kamil Mohammed chaired an important crisis meeting this morning. The meeting took place at the People's Palace and was attended by several members of the government and representatives of the defense security forces. During the meeting was widely discussed the current situations of general containment decreed by the President of the Republic in order to protect the Djiboutian population against the coronavirus pandemic that is gaining more grounds around the world. Also, the current health situations was discussed during the meeting chaired by the Prime Minister. According to the Prime Minister, the Republic of Djibouti has identified 15 positive cases, of which the Spanish military repatriated of the clinical studies of these cases in stable and has not complications. General and specific fiscal measures will be announced to support business and other economic sectors affected by this health crisis. The defense and security forces are working to ensure that the population complies with the containment measures to prevent the spread of and contaminations of the coronavirus. The Minister of Health, Mohamed Warsama Diriye, in his speech recalled that the Ministry of Health has acquired equipment for the diagnosis of coronavirus with a capacity of 100 tests per day. Prime Minister Abdul Qadir Kamil Mohammed, in his speech, first praised the dedications and effort of the frontline health care workers as well as the defense security forces. According to the Prime Minister, the Republic of Djibouti has identified 15 positive cases, and of which the Spanish military repatriated the clinical status of these cases is stable and that has no complications. General and specific fiscal measures will be announced to support businesses and other economic sectors affected by this health crisis. The Minister of Health, Mohamed Warsama Diriye, has made a statement and he declared that today our greatest concern is how we are going to fight this virus while being united. You know that this virus has shaken all the great powers of this world. Today being March 28 March, we have in the usual press briefing started that 43 people have been tested and 2 cases have tested positive. In our investigations, we have discovered that these 2 people declared positive have been in public places like Mabrasa. Common interest for all of us not to go to the public places, not to do and attend the weddings, and to respect the measures given to you. These preventive measures can blunt the virus and can help prevent the virus from spreading. I saw this video of this young woman who is in Alta right now on social networks. This young woman has shown patriotism, she has shown responsibility, she has saved thousands of lives, reminding us that since her arrival in Djibouti, the instructions she was given were to be quarantined for 14 days at home, limiting contact with anyone. She has followed in full all these instructions given to her by the competent authorities, and today all the people in her family and her have tested negative. This strengthen the strength of and spread of this virus is found when a person is in a public place. It is necessary to be careful at all public activity, including outings, crowded places, and to reduce all contact. Social contact must be minimized, which means limiting all social engagement. The government has decreed that each person must stay at home for 14 days. That way, we want to see those who are contaminated and those who are not. That way, we will curb the spread of this virus, and we will do among the countries that have been saved. My department has established an action plan to fight this virus, whether it be in terms of equipment, in terms of staff. We are going to put more than 120 research beds at the hospital. We have set up a laboratory inside the Bufar hospital. It is a laboratory that meets international standards. The Secretary General of the Ministry of Health, Dr. Saleh Benoita Turab, gave us briefings at COVID-19. He stated that yesterday, March 27, 2020, 43 people were tested, 2 tested positive for the coronavirus. We count a total of 14 positive cases of COVID-19 in the country. These cases are still clinically satisfactory. They are monitored and treated in Artas Treatment Center. Today, 53 people remain under surveillance in the quarantine centers. A meeting chaired by the Prime Minister was held this morning at the People's Palace with the COVID-19 Pandemic Crisis Management Steering Committee to review the actions taken, examine their effectiveness and constant. The committee also examined the measures to be taken in the event of possible worsenings of the situation. We urge you to respect the preventive measures issued by the government for your own protection and that of others. Stay at home. Coronavirus screening is still underway at the screening centers of Bufar Hospital. A team from the RTD visited the screening centers today to see firsthand the progress of screenings for the suspected cases of COVID-19. Dr. Hussein Yusuf Darar, an infectiologist, takes direct charge of people in order to analyze their symptoms in COVID-19, whether the person has signs of cough, fevers, and a respiratory problem. The caregivers are effectively mobilized in this quarantine center. They are on hand to provide assistance and analyze the symptoms. We meet doctors of the laboratory technicians and also nurses who are all confronted with these risks on a daily basis. This is a laboratory technicians Yassin Ahmed Wabri and general practitioner Abdullah Saeed Abdullah, who are asked to stay home to prevent the spread of the disease. That's the only wish we would like to extend to our people today. The Ministry of Health Hygienic Service are also on course and are also mobilized to disinfect the places based by the suspects from COVID-19 to the quarantine center. This is Health Inspector Ahmed Saeed Salim, who explains that the sanitation department disinfect the places from the time they are entered and exit. During the period of general population containment decreed since 25 March by the government, the Central Bank of Djibouti remained users of the country's financial institution that banks remains open to offer services to their customers. The customer's financial institution must scrupulously observe the health instructions and barrier measures, distance, hygiene, and precautions put in place by the competent national authorities and financial institutions as part of fight against the pandemic coronavirus. Since the official announcement of precautionary measures against the expansion of COVID-19 in Djibouti, the gendarme of the Territorial Brigade, reinforced by those of the mobile grouping, have been monitoring compliance with these measures through their district from Ras Dika to Balbala via Bul'os, without forgetting the interior region close to the population and local traders. The gendarmes are constantly sensitizing them on the health risks relating to the COVID-19 virus, but especially on the importance of respecting the measures decreed by the head of state, His Excellency Ismail Omar Guelleh, indeed relying on the existing links between the gendarmes and the brigade inhabitants of the districts and elders of the neighborhood. The message of prevention spreading colossal means have been deployed by the gendarmerie to carry out this crucially important mission because of its extensive territorial coverage through the country. The National Gendarmerie is also active in the interior region from Kassal to PK19. The gendarmes in the region carried out the same missions as their colleagues in the capital. Also, you have just seen a strengthening of surveillance. Our teams that this afternoon crisscrossed the municipality of Balbala, more precisely at PK12, met in some places people who are still unaware of the danger and who are kept their habits, meetings in the madrasa, among others, non-compliance with the applications of general containment, as well as unjustified gatherings and movement are commonplaces. The images speak for themselves. That woman from PICA 12 who called us to ask for the security reinforcement. For the international scene, the great reapers of the service of the COVID-19 has never been so restless in a country hit by the pandemic. Nearly 1,000 Italians died in a single day, according to the official count given by the authorities on Friday evening, the worst daily death toll in the world. It is already in the peninsula that a previous world record of 793 deaths had been reached on March 21. This appalling peak brings the number of people who died on Italian territory to 9,134. The only small glimmers of hope lies in the slowing of the contagions, which is being confirmed. The increase in cases of contamination is 86,000 in total, estimated on 27 Marches at 7.4%, the lowest rate since the new coronavirus offensive began in Italy more than a month ago. Faced with the constant descent into the hell of the Italians, the Higher Institute of Health could hardly reassure them. Its directors stressed that the peak of the epidemic had not been reached, but that it could perhaps be in the coming days. This is it for the news. Thanks for watching us.